everyone. Welcome. Thank you all for joining us today in Fibroids Unveiled, Understanding the Impact on Black Women. I am your host today from blackdoctor.org. My name is Alexis Lamoni, and introducing today, I have two guests with us that I think are going to be a great addition to the show and ready to provide lots of information regarding all things fibroids. So joining us, we have Dr. Shaw. And we also have Latoya Dwight that will be joining us in just a moment. So feel free to just comment down below. Let us know where you're joining us from, where you're watching from. And if there are any questions that you guys have, anything that you would like to ask our guests, please go ahead and drop your questions in the comments down below. And we'll go ahead and get started. All right, perfect. Thank you all for joining us. Like I said, so we have Dr. Shaw joining us from the Preferred Fibroid and Vascular Center, and we have Latoya Dwight, who is the founder of the Fibroid Pandemic. So just to go ahead and kind of get us started, Dr. Shaw, would you be able to kind of explain to our audience what fibroids are and pretty much the basics for anyone out there who may not know?
Sure. So thank you so much for having me, and thank you for holding this forum and allowing people to learn about fibroids and giving them the tools and resources that they need to help address these issues. Uterine fibroids are basically, they're benign tumors, and I know that's a scary word, but it has nothing to do with cancer. They're benign growths in the uterus that are made of the same material that the uterus is made of, but it's just growing in an abnormal shape. Usually they grow into these spheres, and these spheres made of this uterine tissue are called fibroids. Now, the reason that fibroids can cause problems is because, like any abnormal growth in the body, they require an abnormally increased blood supply. So when a patient is having their menstrual cycle, there's already a significant amount of blood being directed down towards the pelvis and the uterus in particular. But if you have fibroids on top of that, then you have something that is demanding more blood on top of a situation where there's already a lot of blood going down there. And then ultimately, as the cycle progresses, all that blood comes out. So when you have fibroids, you have all of these benign growths that are taking all of the blood that your body worked so hard to make and just basically wasting it. But during the menstrual cycle, the fibroids, not only do they take the blood, but as they're taking the blood, they swell up in size. Mm-hmm. And that combination of extracting blood from the body and swelling up in size causes a whole multitude of symptoms. What are these symptoms? They are very heavy menstrual bleeding to a point where patients have told me they cannot leave the house. They're hesitant to go to friends' houses. They have to take time off of work. They have extremely low energy. And so, as you can imagine, this is extremely disruptive to their lives and very detrimental to their quality of life. Heavy menstrual bleeding is just one thing. Severe pain and cramping is another one where, again, patients have to take pain medicine. They may even have to go to the emergency room on a regular basis to deal with this pain. Heavy bleeding and cramping are the two main symptoms that fibroids can cause. Now, there are a lot of other symptoms which aren't as prominently discussed, but they are just as severe. And these can include very painful sexual intercourse, thigh pain and back pain, increased urination. Some women tell me they're getting up once an hour throughout the night to go urinate. And this would happen when a fibroid is growing in the direction of the bladder and pressing on the bladder. So even when there's a little bit of urine in the bladder thinks it's full because there's something pressing on it. So then the patient has to keep on going to the bathroom. It can also cause constipation as well. So if there is a fibroid in the back of the uterus and it's pressing on the rectum or another part of the large intestine, then it can cause constipation. But this is just a few of the symptoms. There are other ones, but those are kind of the big ones that people talk about. And so when patients come and see me, they often have all of these symptoms. And I do see that one of our viewers also did say they had all the symptoms. And unfortunately, this is something I hear from so many of my patients, that they have had these symptoms for such a long time and they may not have known why, or they really did not seek care because they were assuming this terrible way to live was normal.
Wow. Thank you so much for that excellent overview. As you know, and like you mentioned, we have, our viewers coming in talking about a lot of the symptoms that they've had. Personally, I know a lot of family members and friends as well that, it's just a regular cycle for us, right? So we think, yeah, it's just another week. It's another 2 weeks where I'm affected by this. But having maybe even just being afraid as the symptoms show up, and not really knowing how to proceed forward. So with that, I want to turn it over to Latoya Dwight, the founder of the Fibroid Pandemic. Latoya, I would just love to hear your story. I'd love to hear about what made you want to start the Fibroid Pandemic, and just, hear all about that.
Well, first and foremost, Alexis, thank you and blackdoctor.org for having me. As I always say, I know that there are several other individuals who can be sitting on this panel at this very moment. And the fact that you all have invited me and extended the opportunity, I truly, truly appreciate it. So thank you so very much. To your question, I started the fibroid pandemic based on my own personal journey with uterine fibroids. It actually happened by happenstance. I found out that there were fibroids on my uterus by mistake, meaning that my then boyfriend, who's now my husband, he and I decided that we're going to be exclusive and we did not want to have an unplanned pregnancy. So we agreed that I would get on birth control. Because of my lifestyle, I travel quite a bit. So I knew that taking a pill every day would not work. So I decided to get on the IUD. Within 5 years, the IUD needs to be replaced. I went to go get it replaced to my OBGYN, who I had been going to for over 12 and a half years. I get in there and she was unable to locate the IUD. So she sent me to ultrasound. Now, painting the picture, right? This was literally within the same exact doctor's office visit setting. So she didn't see me across town to a, freestanding ultrasound clinic or anything like that. She literally sent me down the hall, probably 2 doors down inside her office suite to ultrasound. I get in there with the ultrasound tech. She performs a topical ultrasound. She was unable to locate the IUD, so she did a vaginal, and she was able to locate it rather easily. Then as I'm kind of getting myself back together, put my clothes back on, she says to me, I guess trying to, exercise really good bedside manners. She asks, how are my fibroids coming along? And I go, what's that? Had no idea that there were fibroids on my uterus.
Wow.
The look on her face was, she was really, you could tell she was kind of mortified and she probably spoke out of turn. So she ended up having me talk to the doctor. She goes, oh, I'll let you talk to the doctor. A little bit kind of casual. So I'm like, okay, that was kind of interesting, a little bit weird, but okay, no big deal. So I get back in there and my doctor, again, who I had been going to for 12 and a half years, she's very almost robotic to where she's just looking at her screen on the computer and she's looking at her schedule in order to find a new date for me to come back to have the IUD replaced. Because by this time, so much time had passed by and my doctor's office visit, pretty much was over. So she needed for me to come back. And I asked, stop for 1 second, like, can we talk about those fibroids things where that the ultrasound tech mentioned? And she goes, oh yeah, they look rather large. Now she never explained what large meant, nor did she explain what fibroids were. She pretty much said, yeah, they look rather large. Yeah, we did find some fibroids on the ultrasound. So, because of the size, I recommend you get a hysterectomy. This was literally the first and only thing she even mentioned to me.
Wow.
So I was a little bit taken aback and I'm like, well, hold on, time out. Let's I'm trying to process all of this. Mind you, again, I was just going to get my IUD replaced.
Mm-hmm.
So I asked her to kind of, take a step back. Let's kind of walk through this so I can get a better understanding of what fibroids were. How did I contract them? Were they sexually transmitted? Were they within my DNA? Can they take the IUD out and they just simply go away? I literally had no idea what fibroids were. And her words verbatim was, they're like kudzu. If I cut them away, they're just going to grow back. This is the reason why I recommend that you get a hysterectomy. And this is a doctor I had been going to, as I mentioned, for 12 and a half years. So for her to compare my womb, this is a place that life is birthed from.
Right.
For her to compare my womb to kudzu, which are weeds that grow up, outside, as you can probably imagine how, offensive, devastating that was. I had so many different emotions running through me. Literally, I was confused. I was frustrated. I was angry as heck. And to be quite frank, she didn't give me anything to go on. So I remember leaving and I get in the car. I call my then boyfriend. I'm trying to explain to him, hey, I just got this diagnosis. And Alexis, that added another layer of confusion, frustration, anxiety, embarrassment, because I did not have the tools to be able to articulate to him what was going on with my body. So if you can imagine, that added another layer of emotions that I wasn't even prepared to deal with, all within the time span of a doctor's office visit.
Right.
So I left confused, frustrated, and I literally that was the pivotal moment to start my own research. I researched for 4 years. I did various coaching programs, some that worked well, some that didn't work so well. I did yoga, I did qigong, I did the whole eat for your blood type diet. I did just about everything I could think of. And I eventually settled on having uterine fibroid embolization, which Dr. Shaw mentioned, is basically blocking the blood supply that feed the fibroids. At that time, the fibroids were, the two largest were 11 centimeters and 7 centimeters. If you can imagine, it was about the size of a grapefruit and like a small melon. And it was very common for people to ask if I was pregnant. So after I had UFE, I posted on my personal Facebook page about it. It was, literally Fibroid Awareness Month was wrapping up, and I kind of posted on my personal Facebook page to be a little bit lighthearted. And the reason why I say lighthearted is because while I was under anesthesia, my husband took a video of me and I was talking about the land of the Smurfs. Actually, I posted on my Instagram page a couple weeks ago, so you guys can go back and look at it if you want to laugh. But it was more so a little bit lighthearted, but it was also the call to action. Hey, listen, if you've been dealing with this, do something about it. Don't wait until it's too late, And my cousin called and she said to me, did you see your Facebook page? I'm like, no. So I literally picked up my cell phone. My DMs are blowing up. My text messages are blowing up. And my phone, literally, people are calling me. And at that very moment, I realized that this is way bigger than me. I had people, Alexis, singing to me, had I heard your story sooner, I probably would not be divorced. If I had heard your story sooner, my 20-year-old probably would not have had a hysterectomy. If I heard your story sooner, I probably would be able to have children. And so I realized very quickly that this is bigger than me.
Right.
And that's literally what made me start the fibroid pandemic. In all transparency, I Googled what's the difference between an epidemic and pandemic.
Mm-hmm.
And because I almost named my company the Fibroid Epidemic, but this is truly a global issue.
Mm-hmm.
And that's honestly how the fibroid pandemic was born.
Wow. I am blown away. There's so many comments coming in talking about, this is my story. I have a similar story. I relate to your story, just from my own experiences. I mean, what an experience. And I think one of the things that is so beautiful to see, it's unfortunate, but there are times where, we're in this kind of bubble of pain, right? And we don't understand why we're going through something. And there's something in us that kind of goes off and says, I need to turn this into something, or kind of by accident, like it happened to you. You posted something and it blew up and you said, yeah, I need to make this more than myself. This is, you started out of curiosity on how to kind of heal your body, how to heal your womb. And, you went on and you started the fibroid pandemic. So for our viewers, why don't you tell us a little bit more about the fibroid pandemic? I'd love to hear that.
Yeah, so the fibroid pandemic, it is an LLC, it was created to help provide resources to humans with the uterus who are looking to overcome uterine fibroids by way of resources, communication, various events, and tools that can help the individual overcome fibroids. I do have a nonprofit, which is called Pad the Pandemic. And Pad the Pandemic was created to help eliminate period poverty and unnecessary hysterectomies.
That is incredible. I love that. And I'm so moved by your story and your work. Thank you for joining us, talking about how it's an honor to, be with us, but really it's an honor to be here with you and share this space. And so, with that, Dr. Shaw, I would love to turn it back over to you and just kind of touch on that topic of what would you say, that you have noticed, what would you say is the prevalence of fibroids among Black women, maybe even compared to some other racial or ethnic groups? And what would you say are some factors that may contribute to this disparity? And Latoya as well, if there's anything that has come up in your personal research, I would love to hear your response to this as well. Oh, Dr. Shaw, if you're speaking, you're on mute. Yeah, go right ahead.
That women of any race can get fibroids, but it is a majority of women who get fibroids are African Americans, and the majority of women who get symptomatic fibroids, meaning fibroids that actually cause issues, are African Americans as well, up to 80%. The percentage will vary depending on what your source is, but just partially because of where I am practicing, which may contribute to it, but I would say virtually 100% of my uterine fibroid population are African American women. And so as a result, I unfortunately do hear the same story of, the significant impact that uterine fibroids are having to my patient population time and time again.
Absolutely. And Latoya, did you want to go ahead and add on to that as well?
Yeah. So your question, I just want to make sure I understand the question. You're saying what are some of the things that contribute to fibroids, or?
Yeah. What were some of the things that you've come across in your own research as well? And when I say research, I don't just mean like your lived experience,
Right.
in addition to the research you've come across as well.
Yeah. So one thing I would definitely add to what Dr. Shaw just mentioned, I mean, I could not agree any more that, about, 80% of Black humans with a uterus definitely will develop fibroids. Oftentimes I'm asked, well, why do Black humans with a uterus develop fibroids more aggressively, more frequently? And there are several reasons to that. Some of the answers people may not like, but it's real. It's the reality of this condition, this dis-ease. One thing I would say, just to help educate people, is that although there's no known cause in our medical industry as to why fibroids are developed on a uterus, I will go on the record with saying that estrogen is a main culprit of it. And as human beings with the uterus, we are already estrogen dominant beings. We birth children, so let's just be honest. But a lot of the food that we eat contains a tremendous amount of estrogen. So not only are we already estrogen based beings, but now the birth control that we're prescribed, the food that we eat, whether it's dairy products or processed foods, a lot of those, when you combine all those elements, we become so estrogen dominant that our body cannot get rid of the toxins. So a lot of it just goes straight to our womb and it stores there. So one of the reasons why Black women develop fibroids more frequently and more aggressively is not only because of the estrogen, but to be very honest, because of our BMI. Estrogen, when it's estrogen is stored in fat cells. So with the BMI, if you have a higher BMI, you are more susceptible to developing uterine fibroids. So getting out there to, moving your body, doing various exercises, whether you're just walking, doing yoga, whatever, is very, very key in trying to help minimize or lessen the fibroid bulk symptoms. But other things is definitely the food, fried foods, dairy. Dairy is like off the charts, fried foods, processed foods. I personally have not eaten red meat since 1997, knowingly or willingly. I have not eaten pork since I was 16 years old, and my son is 29. So really trying to eliminate those items from your diet. But also, not only just eliminating those items from your diet, but also now introducing a lot of the fresh, organic fruits and veggies, dark leafy greens, plant-based proteins, things of that nature can truly, truly help as far as a fibroid healing journey goes.
Yeah, absolutely. Absolutely. Thank you so much for that overview. And Dr. Shaw, I also wanted to go ahead and ask as well. So, on the topic of food, right? And, really kind of taking control of one's journey. I would assume that, when your patients come in and you share the news with them, hey, you've got fibroids or you're on a track that doesn't look so great. There's got to be a disconnect, or maybe you notice that disappointment, right? That fear, that worry. So when you notice that kind of reaction, or that look across somebody's face, what is it that you advise them? I know every patient is different depending on the state and where they're at, but generally, from what you've been able to see, what have you advised your patients, and what would you advise our audience, maybe someone that's struggling with this right now, whether it's taking control through food and certain food groups, or doing certain exercises? What are some things that people can do to empower themselves, to just feel in control of their fibroid journey and of their womb center?
Okay, so I would answer that in three parts. The first is when a patient comes to me initially and by the time a patient makes their way to me, they usually know already that they have fibroids. But since you're talking about the initial counseling that happens, the first thing is to reassure them that the development of the fibroids isn't their fault. So there are a lot of things that can help mitigate the effects of fibroids, and all the things that Latoya touched on very thoroughly, such as diet and exercise. But just because somebody has fibroids, it doesn't mean they just weren't simply doing enough diet and exercise and other lifestyle related things. And then the second thing is to start advising them on certain aspects of lifestyle and food intake. And I don't necessarily need to get into that too much, because I think Latoya's answer was very thorough. Because what she said regarding dairy products and things that contain saturated fats and cholesterols is definitely on point. This is in part because saturated fats and cholesterols are the precursors, the building blocks to hormones in the body. And so when you are taking in a lot of that, then you can actually end up exposing the body to higher levels of certain hormones. So when we talk about that, we have to kind of divide it up into women who have fibroids and are not feeling the symptoms yet versus women who are already feeling symptoms. If you already are feeling heavy symptoms, then certainly all these diet and lifestyle changes are absolutely crucial, but it's going to be very challenging for someone to walk back symptomatic fibroids. This is more helpful for women who have fibroids but aren't experiencing symptoms just yet. And so that is an important distinction to make. Once a patient actually has symptomatic fibroids and wants to do something about it, and this is kind of answering the second part of your question, then it is very important for the patient. And again, I know that you already are going through so much as patients, but you do have to do your homework, because you want to make sure you know all your options. In my opinion, there are no bad options to treat fibroids. There are just ones that are more appropriate at certain times, and certain situations call for certain treatment modalities. And I'm not sure if this is the right time to do it, but did you want me to review the different treatment modalities for fibroids?
Absolutely. Absolutely. Yes. We'd love to hear that.
Okay, so the traditional one, as Latoya has already touched upon, is hysterectomy. And hysterectomy is removing the uterus as a whole. Now, in the past, this was a very major surgery that involved, a very large lower abdominal pelvic incision, and it basically took you out of commission for several weeks, and there were a higher rate of complications. Now, thanks to robotics and minimally invasive techniques, it's still a major procedure, but the techniques have been refined to a point where the impact is not as great as far as how long you're down and some of the complications that can occur. Both of these procedures do require a hospital stay, and they do require a much longer recovery period. And for women who want to preserve all the body parts they have, and especially for women who want to have children in the future, obviously this is not an optimal option because the uterus is being removed. So then we move on to less invasive options. The less invasive option would be what's called a partial hysterectomy, and that's if you have a fibroid that can be removed in and of itself without removing the entire uterus. Now, this is effective for removing several fibroids, especially if they are accessible via surgery. But if a patient comes in and they have dozens of fibroids, then again, this would be a very challenging procedure to do because it would be a very long surgery with higher morbidity. And going down to even less invasive options, and this is what I do, is called uterine fibroid embolization. Uterine fibroid embolization is a fancy way of saying you are cutting off the blood supply to the fibroids. And this is a procedure in which a tiny microcatheter is placed under X-ray guidance to the blood vessels that supply the fibroids directly. Then a bunch of near microscopic beads are injected into the blood vessel, and they block the blood supply to the fibroids. Then the fibroids die because they can't get any more blood and they shrink away. And the advantage to this is it's an outpatient procedure that does not require hospitalization, and it's minimally invasive. I actually challenge my patients a couple of days after the procedure to actually find where I even went in to the vessel. And a lot of times they can't. And this treats all the fibroids at once, and it preserves the uterus itself. When it comes to issues of future fertility, several recent studies have shown that if fibroids are one of the reasons that a woman is actually having trouble getting pregnant, then this procedure has a very good chance of helping by reducing that fibroid burden and giving a fertilized embryo an actual safe place to land in the uterus. There are other options that even developed after uterine fibroid embolization. There is focused sonography, which is basically aiming a very high frequency sound wave towards a fibroid and basically destroying that fibroid. Again, that can be a good option, but it will only allow you to target individual large fibroids, and it really can't do many fibroids at once. And there are some new medications out there. I'm not going to get into those extensively because it's really not my field of expertise. So I don't want to speak out of turn. And then there are other procedures out there that can help stop bleeding related to fibroids and other causes of dysfunctional uterine bleeding, but don't necessarily get rid of the fibroids themselves. So really, if we want to break it down into the main categories, you're going to have full hysterectomy, partial hysterectomy, otherwise known as myomectomy, uterine fibroid embolization, and focused sonography.
Thank you so much. That was such an excellent overview and really, really thorough. And thank you just for guiding us through that. It's informative for me as well and really great to know. And we have some questions in the comments too that I think would really be great for us to go ahead and kind of walk through and talk through. So Francis is wondering if there is any genetic relation to getting fibroids.
There is definitely a genetic relation. And I don't want to say every patient, but almost every patient that comes in to see me about fibroids says their mother had fibroids, their aunt had fibroids, their grandmother had fibroids. And so there is definitely a genetic component. And recently, some studies have actually isolated some of the specific genes which modulate the growth of fibroids. That definitely is a future promising pathway into maybe some targeted therapies. But after having some discussions with Latoya, I know that she does have some a more personal aspect on that. So if you want to comment on that too.
Yeah, I do agree with Dr. Shah that yes, there is a genetic relation to developing uterine fibroids. However, it doesn't guarantee just because your grandmother or mother or auntie had them does not guarantee that you will develop them. It's a very high chance that you will, but it doesn't guarantee. And I say that because to Dr. Shah's point about your DNA. Um, Speaking from the perspective of environmental, right? If you grow up in a household in the environment to where you're eating a lot of fried and processed foods, if it starts with your great grandmother and you live in a very high stressful environment, a lot of chemical based products, right? The our toiletries, our beauty products, etc. At some point, yes, it's going to become intertwined into your DNA. But I know individuals who grew up in a very stress-free environment, exercise all the time, 100% vegan all their entire lives, as well as their parents, and they still develop fibroids. So yes, it's very likely that you will develop fibroids if your mother or someone else has, but it's not a guarantee. So I want to make sure that people understand. It's very likely that you will, though.
Absolutely. Absolutely. Thank you both for your amazing answers. I also wanted to touch on two things. So earlier, we had Marcella go ahead and ask, how do you know it's fibroids? So I know we talked about different symptoms and things that can come up. Dr. Shaw, in your experience, have you seen anyone that has gone and, they finally listen and they're like, okay, something must be wrong. And then they go through, the examination process. The doctor tells them nothing's wrong, but the symptoms kind of persist. What would you say to that person? Or have you had somebody come in and say, yeah, a couple of months ago, everything I was told I was fine. And then, they're kind of at your center seeking out your guidance. And how does someone know to kind of keep pushing and keep advocating for themselves, even if for whatever reason, maybe that day the technology has failed them?
So to answer that question, I would very, very, very much hope that if somebody did have fibroids and they were worked up for it, they would be informed as such. But the question you're asking is very interesting, and it doesn't necessarily relate to fibroids, so I'm not going to belabor the answer. But there are a multitude of other causes of abnormal or heavy uterine/vaginal bleeding that are not caused by fibroids. And I'm going to name some of the entities, but like I said, that's a topic for another time. You can have pelvic congestion syndrome, adenomyosis, endometriosis, and then a whole host of other things that can cause these symptoms. So a lot of times patients do end up coming to me with dysfunctional uterine bleeding and no fibroids. And so those are other things to consider. If you are having these symptoms, and then to go back to that original question of how do you know it's fibroids, if you're having these symptoms, the first thing you need to do is go and see your primary care provider or OBGYN or me. And the very first step is getting a simple ultrasound examination. This is a relatively quick imaging study, and it just takes pictures through sonography of your uterus and other pelvic organs. And that is the best screening test. If you have fibroids, they will show up on sonography. And so the straightforward answer to how do you know if you have fibroids is you get an ultrasound. Now, some of the challenge in that is many, many women, in fact, all women who have symptomatic fibroids, they started out at one point having non-symptomatic fibroids when they were very small. Unfortunately, there's no reason to routinely image every single woman across the board. In any clinical situation, there's no reason to image every single patient across the board. So it's not really pragmatic or possible to discover fibroids in their infancy on everyone. And so that's one of the things that makes it challenging to kind of know that they're there before they start causing issues.
Got it. Yeah, I really appreciate that, and just you again, just kind of really delving things out for me. I'm learning with you guys, with the audience, as we go question by question. Latoya, I also wanted to go ahead and ask you as well. So I heard you mention earlier, correct me if I'm wrong, that your website seeks to point individuals to resources to kind of help them get the healthcare that they need. And so I'd love to hear a little bit more about that, just because I know that there are some individuals out there that maybe don't have access to insurance or are afraid to go to the doctor, maybe because of just the lack of resources available to them. So I'd love to hear you talk about just your website a little bit in that respect, and your nonprofit, and just speaking to that and informing our audience of what's available in the event that they're in this situation.
Absolutely. So if you go to the fibroidpandemic.com, you can actually submit a request for a one-on-one consultation. So I can help walk through what you are experiencing and then help provide guidance as to which direction you may want to consider or not consider. I also do various events. I just had my flagship event just this past Saturday, 5K run walk for youth and fibroids called Run FAR. 5K, and FAR is an acronym for Fibroid Awareness and Resources. It is an annual event, so we'll be coming back next year in 2024, so be on the lookout for that. But also, as far as resources, I am pleased to announce that we will be launching our provider directory very soon. So thanks to blackdoctor.org and your team for giving me the encouragement and your head nod to proceed with that, because it's very, very important that people have options other than just a hysterectomy. Now, I do not believe there's anything wrong getting a hysterectomy if you truly need it. But statistically, it's said that roughly 60% of hysterectomies that are performed are not necessary. So just really knowing your options is going to be really key.
Yeah, absolutely. I love that. Fighting back the tears, honestly, but I'm just so excited for you and your journey. I think that that's just beautiful. And I'm just really, really thrilled to hear that. And I also wanted to go ahead and ask, so we have Cindy that went ahead and asked that she, her pain is always at a 10 when it comes to her experience with fibroids. So what can you both tell us about, managing that pain for the fibroids? And Latoya, if you feel open enough to speak to your personal experience, and Dr. Shaw, what you recommend to the patients that you see as well.
Absolutely. So that's a really good comment that she made. For one, there are two things I would say to start immediately if she's not already doing it. Number one, move your body. Get up and move your body, whether you are doing the elliptical, whether you're walking on a treadmill or whatever. Move your body so that you can try to help burn the fat to lower your BMI. And you can do any type of body movement. It doesn't have to be a marathon or, sprinting, whatever type of movement that you can physically handle. Move your body. Number two, a really key way to start eliminating or minimizing a lot of those symptoms is to, as I mentioned before, is to really help focus on what you're intaking as far as your food intake. So as I mentioned earlier, removing all the fried foods, removing all dairy, food products that have a ton of processed foods or a ton of different ingredients, artificial ingredients, and really focus on incorporating fresh fruits and veggies. I'll give you an example, Alexis. I make my own juice. Once a week, I'm in that kitchen making my own juice. I'll do like 8 different, 16-ounce bottles. I grab it in the morning and have that for breakfast. I may do celery juice. May do a mixture of kale and apples and pineapple, whatever. Anything to really help flush my body. So the more you are flushing the system, the more your body is able to get rid of the toxins. Again, because these fibroids are developed from various things, including toxins, right? So by keeping your body flushed out, getting lymphatic massages, that can be tremendously helpful. But also different things, and I know a lot of people are a little bit hesitant to do this, but really, really focusing on the types of sanitary products that you use. It's very common to go to the local grocery store, pharmacy, or Walmart or whatever to grab that one pack with wings and organic or whatever. but you want to really pay close attention to what it is that you're buying. The majority of sanitary products that sit on our shelves to this day are laced with so many ingredients, even ingredients that are outlawed in other countries. Like dioxin is one, right? Look it up. It's outlawed in several different countries. But this is a main chemical that's used to purify the sanitary products and make them look natural and clean and white. But what you're not realizing is that you're literally feeding what I call feeding your uterus a slow death. So definitely make sure you're paying attention to those chemicals that you are using as far as your sanitary products, because that can be a tremendous culprit to not only developing, but also enhancing the severity of the fibroids as well.
Absolutely. Absolutely. I'm blown away every time either one of you speaks. So thank you. Thank you for that. I also wanted to go ahead and, I'm sorry, Dr. Shaw, I also wanted to ask, so when you have individuals that come in and they're talking about that pain, or maybe, and this is actually, I'm going to kind of gear into my next question. Some of us, like myself, have food addictions, right? I'm addicted to the dairy, addicted to meat, and all of these different things. So when these suggestions are paired with, pain management and things like that, what would you suggest to someone that says, I'm addicted to this stuff, I can't do it, or, I'll start juicing, but I can't stick to it. So what would you suggest to a person that wants to manage their pain, but their body is physically fighting this addiction that it has to the food, to the toxins and the different things that we use, the different sanitary products that we use? Francis went ahead and talked about how women should not use tampons. And I've had my own personal experience with that. And I haven't used tampons in years now, so all of those different things, what would you suggest to someone that is really trying to make the change, right? But maybe they're really struggling to kind of follow through and stick to that commitment?
Well, I think that the first thing that has to be established is it's not an all or nothing game. So just because you love eating dairy or you love certain meats, it doesn't mean you have to get rid of them. Any reduction you can do is going to be a step in the right direction. And I sincerely believe that once a patient starts on that pathway and making some minor changes, the benefits they will feel overall will naturally allow them to gravitate towards making further changes. Because I do want to point out all of the things that Latoya has mentioned go way beyond uterine fibroids. As huge a topic as uterine fibroids are, the ideas behind continued mobility, healthy diet, those will raise your those will improve your overall health, and that is good both for the individual and profoundly for society as well. Going back to the question of pain, I think what Latoya outlined is a lot of stuff the individual can do outside of the medical office. And I think it's very important to couple that with what happens in the clinical setting. And so once you've identified the lifestyle changes and the dietary changes and everything that you think you need to make in order to start reducing your symptoms, then finding out what the right procedure is for you to actually get these under control in a clinical sense is the natural, counterpart to resolving the issue in total.
And can I add to what Dr. Shaw just said for a second?
Well, absolutely. Go right ahead.
I agree with Dr. Shaw 100%. It can be, it's not an all or nothing, right? Trying to get rid of, eliminating certain things from your diet, changing your sanitary products, changing your beauty products, it can all become tremendously overwhelming, which can actually add stress to your, which can actually grow the fibroids. So,
right.
What I always tell people is take it step by step, eliminate one thing at a time. Let's see how your body adjusts to it, and then move on to the next, because the last thing you want to do is counteract the process. Again, if you try to remove everything at one time, I'll give you an example. I'll use myself. I always try to use my own personal experience as the best example. When I went vegan, I went cold turkey. Literally one day I was eating chicken, fish, and turkey. Then the next day, probably that afternoon, none of it. And it was very tasking to my body, and I developed a lot of different stress behind it. And eventually, I'm no longer vegan. Shout out to the vegans, please don't attack me. But, I will say that it was so overwhelming to me. Had I gradually introduced myself into it, probably would still be vegan to this day. But again, I want to make sure that people understand that Dr. Shaw and I are not saying you got to do all of this or nothing. Take it one by one, take it step by step until you get to a point to where you feel that your situation is a lot more manageable.
Absolutely. Absolutely. And touching on the step-by-step, approach as well. So Francis in the comments is talking about, ironically enough, eating healthy is expensive today with inflation and different things like that. So when you have individuals that come to you, Latoya and Dr. Shaw, that say, but eating healthy is expensive, organic is expensive, how do you kind of navigate that conversation? And how do we get to a place where we can still integrate these things, still have access to healthy fruits and vegetables, but, kind of do it on a budget while, we're taking care of other things?
What I would say is two things. I'm sorry, Dr. Shaw.
No, go ahead, Latoya, please.
I would say two things, and not to, I don't want to frighten anybody, right? But if this was a life-threatening situation, you would find a way to afford it.
That's very true. That is very true. Yeah.
To the best of your ability.
Yeah,
You would
exactly.
really try hard to afford it. I agree 1,000%. Eating healthy is expensive, but what I find most helpful for me is preparation. I meal prep regularly. As I mentioned earlier, I make my juice. That's my breakfast. I make my own smoothies. I get my own fresh organic fruits and veggies. I go to the farmer's market once a week. Haven't been there in 2 weeks. Time for me to go back. But I really try to prepare. One of my most favorite meals, I'll tell you guys, feel free to make it if you want, but I will make like a big old pot of tricolor quinoa. I'll roast some Brussels sprouts, and I'll get some avocados, and I'll add different types of fruits and veggies, red onions, and I'll make myself a rice bowl throughout the week, just pull from it. And that helps as far as my lunch, my dinner, or a quick snack. I buy fresh apples, and, again, just really trying to plan is a way that I have found it to be helpful when it comes to affording fresh fruits and veggies and organic items, because it can be extremely expensive. The other thing that I would say is take your time. Don't be down on yourself if it's something that you cannot do. But definitely, again, if it was life threatening, you would probably be more willing or to try to afford it to the best of your ability. I don't want anyone to feel bad if they legit cannot afford it, because it's ridiculous. You'll think if they're minimizing the amount of chemicals, it should be cheaper. It should be less expensive. Right? But it's like the opposite. So yeah, just plan, take things in moderation, and really meal prep. That's what I find to be very helpful. And you can find things, again, go to the farmer's market. You'll be amazed at. I'm here in the Atlanta area, so that the Cab Farmers Market is my most favorite, best place to shop. I'm like a kid in the candy factory when I go there. But yeah, just try everything in moderation.
I love that. Dr. Shaw?
I don't have a ton to add to that because that was a very thorough answer. But
agreed.
I think that if you look at some of the most nutrient-rich foods, and I'm talking about both in density of protein, fiber, vitamins, they're not expensive. Legumes, all of them, beans, lentils, the beans are not expensive. You can buy huge bags of uncooked beans, and they are really, truly superfoods. Again, I need to point out, as an MD, nutrition and diet are not my specific wheelhouse. But take from me what you will. But yeah, nuts, beans, seeds, all those are not expensive. And I think when people say, "Oh, eating healthy is expensive," they have in mind this idea of an $8 like little pint of organic strawberries or something like that. That doesn't have to be it.
Mhm.
And so there are many, many ways to eat healthy and with whole, close to the source foods that don't have to break the bank at all.
I love that, close to the source. That is key. That is staple. I'm going to remember that forever. But I wanted to thank you both so much for joining us. I wanted to go ahead and ask one final question. If you had any last final tips that you wanted to leave with our viewers, one final takeaway, what would that be? And yeah, go right ahead.
One thing that I would say is I would leave with three things. Number one, pay attention to your body. Pay attention to your body. I was burning the candle at both ends. I was a full-time employee working Monday through Friday, 9 to 5. I went to school at night. I would take my son with me. I would get off of work, go grab my son from after school, and take him to school with me at night, 5 days a week. And I didn't pay attention to my body. And I didn't realize that I was suffering in silence. There's this thing what we call silent suffering. I didn't realize that's what I was doing. Um, so pay attention to your body. Take inventory. If all of a sudden your menstrual cycles go from 4 to 5 days to now 8 to 12 days, that is a red flag. Doesn't guarantee you have fibroids, but it's definitely something to pay close attention to and have that conversation with your doctor. If physical intercourse all of a sudden just starts to hurt, that can be a key indicator that there are fibroids on your uterus. So, number one, pay attention to your body. Number two, have conversations with your family members to get to understand your family history. Again, as Dr. Shaw and I mentioned earlier, just because a family member had fibroids does not guarantee that you're going to get them. It's a very high chance. Doesn't guarantee it, but it's really good to know what's going on within your family lineage, because after I got diagnosed with fibroids and after I started to conversate about it, I found out, as Dr. Shaw mentioned, my sister, my mother, and then eventually my two nieces were diagnosed. But had I never said anything, I probably would never even know about it. So have those conversations. And lastly, I would say put yourself first. Let go of the silent suffering. Take an extra pair of clothes just in case you have that really awesome meeting that just pops up. So you need an extra suit jacket and extra pair of pants. No, don't let yourself suffer in silence anymore. Have conversations with your significant other, so you can explain what's going on with your body, because perhaps they will be more understanding and it can really help to provide a more just a better fruitful relationship. But those would be the top things that I would recommend.
I love that. Thank you. Thank you for that. Dr. Shaw?
Fantastic, Latoya. I think that I'm going to speak purely from an MD standpoint, is if you, and this really applies to any medical issue, not just fibroids, but if you are presented with a medical option that doesn't sit right with you, it's not the final answer. You are entitled to and you should seek second opinions, third opinions. Whenever a patient sees me and they say, well, this sounds good, but I'd like to get a second opinion. I welcome that, because I am very confident with what I'm telling the patient, and I'm telling the patient what I think is the most optimal treatment pathway for them, the most data-driven treatment pathway for them. And I feel confident if they do go seek a second opinion, then that provider will agree with what I'm saying. And so if you ever have a provider that doesn't want you to seek a second opinion, then I think that in and of itself would be pretty questionable. Make sure that you know what all of your options are. Latoya's story really touches upon that, where she wasn't really given another option beside hysterectomy. Again, I don't want to vilify hysterectomy, because it is absolutely an important and relevant procedure, and is the right procedure in many cases. But it's not always, the one that is optimal for every single patient. So definitely know what your options are. Do your own research. I hate to put certain aspects of the burden of this on the patient, but we live in the information age. There's more information at your fingertips, for better or worse, than there ever has been before. So, and then the last thing is, just as a practitioner of uterine fibroid embolization, I think it is an incredible procedure It has the power to change lives and improves patients' lives and their quality of life for the better. So if you are suffering from these issues, it's definitely something that you should at least consider and look into.
Absolutely. Absolutely. I want to thank you both so very much for taking the time to join us today. This was such an honor, a privilege, and a pleasure to be here with you all. I want to let everyone in the audience know as well that our final show in our fibroid series is coming up at 9 p.m. Eastern. So right after this one will be the final show for that. And I just wanted to thank you all for joining Dr. Shaw, Latoya. It was such a pleasure, and you all have a wonderful evening. Thank you for your time. Take care.
Thank you. Enjoy your evening, everyone. Thanks for the opportunity.
Thank you so much.